other NSA are also doing the same. Aspirin especially the special part platelet a bit more special. Aspirin will commonly use. The aspirin work against platelet at low dose, okay? At low dose, not at high dose. At high dose is just a painkiller. A low dose is working against a low dose is working against platelets. Cyclooxygenase inhibitor here. So what happens? Thromboxane production. Thromboxane production decrease and platelet aggregation. Not allow platelet aggregation will decrease. Okay. So one is aspirin, the other drug. ADP receptor antagonist. Drugs blocking ADP receptors. What's the function of ADP receptor? Yesterday I explained this ADP. ADP comes from platelet, and this ADP act on platelet. Then this platelet doing what? The platelet produce glycoprotein on its surface. Glycoprotein. One is one, another glycoprotein, two, 2B3A. Okay. Two the glycoprotein. What is the function of glycoprotein? Glycoprotein helps in platelet adhesion, and this glycoprotein helps in platelet aggregation. If you block the ADP receptor, then the expression of glycoprotein will decrease. In this group, we have in the drug ADP receptor antagonist, clopidogrel. Clopidogrel, cyclodipine, and the prasugrel, clopidogrel, cyclodipine, prasugrel, and the last one is PICA. The name a bit difficult. Thriller. This one is reversible. The remaining are irreversible. Cyclodipine, clopidogrel, you try to memorize. Clopidogrel is important. We use cyclodipine also have prasugrel. These three are important. Okay. They blocking the receptor, ADP receptor, and then what happens? Glycoprotein expression will decrease. This you already know. This is glycoprotein 1A and glycoprotein 2A, 3B. Okay, this glycoprotein helps for adhesion and aggregation in the when we form the thrombus. So this ADP receptor antagonist, they block the receptor, then no more glycoprotein, and what happens? Adhesion of platelets also decrease, and aggregation of platelets also decrease. Okay, adhesion and aggregation decrease. So what's the uses? The uses of this. So we use this drug in acute coronary syndrome. Okay, acute coronary syndrome when atherosclerotic plaque ruptures, the next formation of thrombus. First, we break the clot by using what? streptokinase, by using altiplase, retiplase, by using thrombolysis. Okay, as the first thing. Then later again clot reform because endothelial injury, platelet aggregation, adhesion again restart again thrombus formation. So in acute coronary syndrome, when you send back the patient to home, you must give antiplatelet to patient. Okay, because the clot again can reform. Clot again can reform. So if you done the stenting, if you put the stent in the artery, coronary artery stenting, okay, if the artery is blocked and then you put the stent after stenting, because stenting, when you put the stent is a metallic thing, okay, a different category of stent there. Stent is a metallic thing, it can damage endothelial, it can damage endothelium. If endothelium damage, what happens? If endothelium damage, platelet again attached to endothelium, the artery again closed, again thrombus formation there. So when you put stent inside the artery, I must give antiplatelet. Understand? In stenting, after stenting, I must give. Clear? The stroke patient. If one time the patient have stroke, thank God the patient now alive, still alive. In stroke patient, again can rethrombosis. Okay. So to prevent the rethrombosis, in ACS, to prevent the thrombosis in stenting, to prevent the rethrombosis in stroke. Okay. Next time, the maybe to prevent the clot formation, we use antiplatelet. Understand? We use antiplatelet. Acute coronary syndrome, stenting, and stroke. This clear or not? Okay. And this ticlodipine, the side effect ticlodipine, it can decrease the neutrophil level WBC going down. Neutropenia is a side effect of ticlodipine. The how about the other side effect? Other side effects they can cause what? They can cause bleeding. Of course, they can cause bleeding because they are antiplatelet. They cause bleeding. Okay, important side effect bleeding. To monitor the concentration, to monitor the drug, which test we perform, we need to check the BT. Why BT? Because these drug against platelet. To monitor the function and the quality and the quantity of the platelet, we must perform BT. Understand? If the drug is overdose, then we need to stop that drug. It can cause more bleeding. Okay. We check the bleeding time. We check the bleeding time. Clear? Okay, now move on. Next, third group, anti-platelet third group. First, we not allow the platelet to become active. Okay, the thromboxane makes platelet more and more active. Then the second group, the active platelet, they release ADP molecule. This ADP acts on platelet to increase the glycoprotein. Yeah. Then we try to stop the ADP receptor and decrease the glycoprotein and no adhesion and no aggregation. Okay. If the platelet aggregation done, the ADP receptor stimulated by ADP and glycoprotein there. Now we try to stop on another side. We try to directly inhibit glycoprotein. Glycoprotein to be free A inhibitor. To try to inhibit the glycoprotein. Understand? To try to inhibit the glycoprotein. The platelet, the first layer of platelet is deposited with the help of this, on the endothelial cell, von Willebrand factor and glycoprotein. Okay, and von Willebrand factor and glycoprotein. Endothelium show von Willebrand factor and glycoprotein. This glycoprotein is glycoprotein 1. This is your glycoprotein 1. So this the first step is platelet adhesion, glycoprotein 1. To attach more and more platelets, To attach more and more platelets, so we need expression of here glycoprotein, glycoprotein, glycoprotein. Here also glycoprotein, 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 glycoprotein. And this glycoprotein is a glycoprotein 2. Okay, glycoprotein 2b3a. This part further like attachment of platelet, further attachment of platelet. Two glycoprotein. This glycoprotein 1, another glycoprotein. These are two glycoproteins. Okay, the glycoprotein 2b3a is also glycoprotein 2b3a. Between these two, what is this molecule? This is fibrinogen. This molecule is the attachment done by fibrinogen. Okay, fibrinogen. Later, after clotting cascade, the factor number 2, thrombin, act on fibrinogen, change it to fibrin. Change it to fibrin. So, this glycoprotein 2b3a. This glycoprotein is the attachment site part. This is one platelet. This is another platelet. You can see how these platelets are connected. Okay. On their surface, they show what? Glycoprotein 2b3a. Glycoprotein 2b3a. These both platelets are connected. This glycoprotein connected with the help of fibrinogen. Understand? The first glycoprotein helps attachment with endothelial cell. Helps attachment with endothelial cell. This side one Willebrand factor, and this side glycoprotein 1, glycoprotein 1, glycoprotein 1. Clear? This side we having one Willebrand factor. This attachment. This is your first step is adhesion. Okay, the first step is adhesion. The second step is aggregation. Okay, no more and more platelet attached. So these inhibitor we also can call it fibrinogen receptor inhibitor. Try to understand here the name here. This is fibrinogen. Yeah, this is a fibrinogen. You can see these two glycoprotein attached with fibrinogen. So this is a receptor for fibrinogen. Glycoprotein 2b3a actually is the receptor for fibrinogen. Understand? So fibrinogen receptor inhibitor also the same name. Okay, they block the glycoprotein. The drugs here, abiciximab. What a drug name here? Abiciximab. Abiciximab. This one. Another tyrofibine. Tyrofibine. Okay. Abciximab and tyrofibine. These two drugs, these are glycoprotein inhibitor. Glycoprotein inhibitor. And these drugs, they're doing what? They block this. They attach here and occupy this receptor, yeah? Occupy this glycoprotein. And not allow this fibrinogen to attach here. So fibrinogen is no more attached here. Understand? This fibrinogen no more attached here. So they not allow this glycoprotein to be connected by fibrinogen because this drug abiciximab and tyrofibine they block this glycoprotein. Okay. So can this platelet was this platelet number 1, 2, 3, okay, now 4, 5, 6, 7. These platelets they're not allowed to attach with these platelets. Understand? The red platelet not attached with this blue platelet. Why? Because you block the receptor. You block the glycoprotein. Understand? You block the receptor, you block the glycoprotein. And when this drug, glycoprotein inhibitor, when we done PCI, it's important you keep in mind. Do you remember when we perform PCI? Percutaneous coronary intervention. For which patient? Remember ischemic heart disease? When we perform PCI, for which patient? If the patient has MI. Which MI? STEMI, ST elevation MI. Your first preference, you must perform PCI. Okay. Another PCI for unstable angina. Your first preference must be PCI. Understand? If you not have PCI facility at your clinic, at your hospital, etc., then you can go for thrombolytics. Okay. If the patient have MI attack, your first preference, gold standard here, first option PCI. When you're doing the PCI, what's the PCI? It's a percutaneous coronary intervention. We try to break the clot. Okay, we try to break the clot by directly going into the artery by using catheter. Okay, understand? So this thing, when you performing this, we use glycoprotein antagonist. So this use for PCI, and also we give for unstable angina patient. Okay, when we perform PCI, we need to use this glycoprotein inhibitor. At what time we use ADP receptor antagonist? Acute coronary syndrome. Acute coronary syndrome. What's acute coronary syndrome? Again, same thing. MI and unstable angina. To prevent the pre-clot formation. For stenting, this thing keep in mind. For stenting, when you perform the stent, for the stenting. After stenting, the drug here, ticlodapine, is very effective after stenting. Okay, ticlodapine after stenting. Understand? The aspirin is also same thing. It's against the platelet. How we manage their timing, their dosing interval, you must continuously check the bleeding time. Okay, if any person having the issue like thrombocytopenia, you must perform if the patient's platelet level is low, platelet level low, thrombocytopenia. Then you must take care about this drug. It's a contraindication. If platelet already low, it can lead to bleeding, and you using antiplatelet is further more chance for bleeding. Okay, you, there must be check and balance. You must assess the bleeding time first. Do the perform this bleeding time test, and then you also need to check the platelet count. Okay, if platelet count is low, then we need to avoid these drugs. Understand? Antiplatelet done. Antiplatelet. Yeah, three group of antiplatelet. One, they block the activation. Another, they decrease the expression of glycoprotein on the surface by blocking ADP receptor. And third group, against glycoproteins. Okay, this is all about full CVS pharmacology. Now we move on next system.